Thank you so much for Mary for a warm introduction, and thank you to all for coming and joining in the Lessons in Leadership program. The military taught me the 5 Ps. I don't know if any of you know the 5 Ps. Military, anytime I would go out on a mission, whether it's a med cap in a village or whether we're going out to pick up casualties, military would say, "Ma'am, have you covered the 5 Ps?" "Yes, sir, I've covered the 5 Ps. That's prior planning prevents piss poor performance. So I always do the 5 Ps. I'm into rehearsals. Even before my surgery, I asked Zach to please do a rehearsal. I said, "I know you've done this 275 times. I know you've got 5-star ratings, but I would like a rehearsal." And as an Army nurse, I had an Air Force pre-op nurse and I had a Navy intraoperative nurse. So they said, "Careful what you do, Zach. You're dealing with the team." I had a meeting here yesterday, a 1-hour meeting. So just pull into valet and ask them to park your car for an hour. So I pulled up and the very nice gentleman said, "Oh, are you a patient? Are you a cancer patient?" And I said, "No, this is what I said. I'm sorry, I don't have cancer." "I'm sorry, I don't have cancer." And he said, "Then you can't park here." But he said, "You can park over there where it says patient visitor parking. Just go right around the circle, take your rental car, go right over there, pull in there." So I pulled in there and the gentleman said, "Are you a patient?" I said, "No, we've already ruled that one out." And so he said, "Which patient are you visiting?" I said, "I'm sorry, I'm not visiting any patient. I'm here for a 1-hour meeting." And he was there with a laptop. Nobody was unkind. He was there with a laptop and going to put in the name of the patient that I mentioned. So next time we have to lie with a real patient. That's what we have to do. No, I'm teasing. But he said, "I'm sorry, you can't park here. This is only for visitors coming to see patients, or if you are a patient." So I said, "Okay, 3rd time's charm, where do I go?" So he said, "Go over to the 7th Street garage and park." And I said, "Okay, how do I get there?" So he's telling me how. You know, it was fine because I used my 5 Ps. And I was here 45 minutes early, so it was prior planning prevents piss poor performance. So I got parked and I could kind of go around in a circle to find the right spot. But I'm just saying, nobody, if you will, did anything wrong, but I was thinking if it were my first visit. It wasn't, and I had a calling and I was going to be here and I'd figure it out. But it could have been, wow, how do I get this car parked? And that's not meant as a negative, it's only meant as fresh eyes experience. But again, I walked in and there was the desk, and when I walked up and said, "Excuse me, could I ask you a question?" But the person did not look up to me and say, "Hello, may I help you?" Well, nobody was mean, but again, one of the Studer concepts, I know that he left, but one of the Studer concepts is that as you walk down a hallway, that 10 to 6 feet, you begin to do eye contact. I don't mean stare people down, but you look at people. And when you get within about 5 feet, you say, "Good morning." And in some cases, Studer says, ask, "How are you doing?" And I'm being honest, there are some people in my hospital I know never to ask, "How are you doing?" You know who I mean, that they'll have a story. But to walk around and say, again, I'm giving just fresh eyes perspective. I wanted more people to say, "Hi, how are you this morning? Do you need any help with directions? You look like you might be lost." You know what I mean? Somebody says, "Oh, no, where? Go to the teal hall." Okay, the teal hall. Okay, green, teal, you know what I mean? And that sort of thing. Nobody was unkind, but kind of those things of if I were here first. Because I'm clouded because as I walk around, I see familiar spaces as I go down the purple hall of where I spent time in class, so I'm kind of pulled off in that direction. But if I were coaching with fresh eyes, I would say, if we could all say hello to each other a little more. Thank you. Thank you. Thank you very much.